Good morning. Oh, shucks.
I can hear you. I could hear you.
Good morning, everyone. And Secretary Becerra, welcome home. We are so proud of you and everything that you have accomplished, and you've earned it all. So God bless you as you assume this high position. We are so proud of you. I just want everyone to remember why we are holding this hearing remotely. Our country lost 600 over 600,000 people in a pandemic. They died. And my district is an epicenter, and people are still dying, and they will continue to die until we can vaccinate everyone and get rid of all of these conspiracy theories and misinformation. And members of Congress are going to continue to get sick and to die until all members of Congress are vaccinated. Now, with that said, I have a couple of questions for the secretary. And I think it would be best if I ask my questions in threes and then you answer them. Number one, school nurses. We have a police officer in every school. We tried to do that across the country. And I'm just wondering, with what has happened during this pandemic, do you agree that instead of having police officers in every school, we should focus on having a healthcare professional in every school? I have a bill that I have been filing for years. It's one nurse, one school. And I filed it through the legislature, through the Senate, and in Congress. And I want to know how you feel about that. Also, the American Rescue Plan includes a temporary 5% federal medical assistance percentage increase for states to expand Medicaid. I'm from Florida. I wrote my governor a letter asking him to expand Medicaid, and I want to know what you would say to Governor DeSantis to make him expand Medicaid, because I'm not having any luck at it. And then sickle cell anemia. What would HHS do to ensure that patients who are Medicaid and Medicare beneficiaries have equal access to all of the innovative therapeutics that are now available? Those are first three.
Congresswoman, great questions and great to see you. You look the same. I love those hats. First, nurses in school. You and I probably remember the days when we were in elementary school and we knew that there would be a nurse there for us. And what a sin that we don't do that for our children today, right? Especially in our schools and most in need to have access to a nurse. If you help us pass the American Families Plan, I guarantee you we will see far more nurses in our schools providing care to our children who really need it, because we'll give the resources to our local school districts to do that. So I hope we're able to work with you to pass the American Families Plan. Medicaid expansion, what would I tell any governor? You got elected to care for all the people in your state, not just some. We're offering you a deal that is hard to beat. We're going to actually help pay for the virtually almost 100% of that cost of that care for that individual who doesn't have access to care right now. And hopefully then you'll buy into it and find that it makes sense to cover someone, because they won't be getting their health care at the emergency room the most expensive way they get it now. And so it's a savings, not just for you as governor, it's a savings for us as a federal government when we get people good care and they start getting the preventative care that keeps them from getting really ill and suffering from those chronic illnesses in the future that cost so much. Finally, sickle cell anemia. Congresswoman, I got to tell you, I think there's some bright news on the horizon when it comes to sickle cell. Finally, we're beginning to see far more investment. But this is where a program like ARPA-H is so critical, because it lets us zero in on these really difficult and devastating diseases and conditions that sometimes are, because they don't hit everyone, are far more expensive to focus on. This lets us target some of those, like sickle cell, certain cancers, and Alzheimer's, and actually come up with a solution. So I hope you'll be supportive of our efforts to start ARPA-H, which will let us go and save lives.
Thank you. Quickly, I chair higher ed, so I'd like to know, how will the HHS budget supports CDC engagement and technical assistance for colleges and universities in the event of an outbreak, now that we're opening colleges and universities.
If you could be very quick, because the time has expired.
Congresswoman, I'll simply say that, as I said before, we can't have holes in our public health network. Certainly our schools, whether college or K through 12, have to be part of that network to protect everyone in the case of a pandemic.
Thank you, and I yield back.
Thank you. The gentleman from Georgia, Mr. Allen.